Hello, everybody. Welcome to another episode of CX on Point. With us today, we have Ken Epstein, one of the partners at Precision Point Partners. Hello, Ken.
How are you?
And I'm excited today because we have Daniel Roth, who we have known for just a couple of years, and we've worked together at a few different places. So it is always nice to have not only a former colleague, but a friend on this podcast. So welcome, Daniel. How are you?
Hey, Alicia, I'm doing great. It's such a great opportunity, a fantastic opportunity to get to be with yourself and Ken. We've known each other over 20 years, and um, to your point, we've worked in the past together, and excited to be here today.
Awesome. So, just since not everybody has worked with us that might be listening to this podcast, can you just kind of give everybody a little bit about your background and maybe where you are today?
Yeah, absolutely. As far as my background goes, I have been in leadership roles over 30 years, and in the contact center space, particularly 24 plus years, driving operational excellence, whether it's in B2B or B2C environments. About two-thirds of that time, I've been in the healthcare space, working for some of the largest healthcare organization, most innovative healthcare organizations out there, both today and in the past. I'm excited to be able to talk about some of those things as we move forward here. And in addition to that, I really focus on building repeatable, high-performing teams. So how do you have a repeatable approach no matter where you're at, no matter how the teams are performing, to be able to get them to a place of high performing? And it can be in both companies that are established and startups. So looking forward to sharing some about that as well.
That's awesome. Well, very good. Well, I think today, we want to really continue our conversation, um, really that's been surrounding healthcare, right, Ken? And
Absolutely.
and so which is a very important topic. And obviously at P3, the team works a lot with healthcare organizations, has a real core competency in that. I'm curious for a lot of reasons. As Ken knows, I've kind of spent my summer in the healthcare land with my aging parent, my dad, I should say, that both my parents are still with me. But it's been a ride with an 87-year-old, and just the whole everything has been complicated, and the experience has been, I would say, subpar and many. So I'm really curious to hear about Dispatch Health, and really the evolution as you see it of not only just the healthcare industry, Daniel, but the impact on the patient and the member experiences. What's changing out there, and hopefully for the better.
Yeah, there's a significant amount of change no matter where you look in healthcare in today within the United States. We're actually in the beginning of what I would call a golden age of healthcare. Science has evolved to a point where, from a DNA perspective, we can drill down to the most minute levels and be able to then build, whether it be prescriptions or procedures, to be able to help people heal and improve. And at Dispatch Health, what we're doing is we're focusing on transforming healthcare by building a comprehensive system of care in the home. So that's what's unique here. We want to bring the power of the hospital to the comfort of the home. We can come out depending on the specific symptom and be able to provide services in the home, including whether it's a simple cough or sometimes something more acute, depending on what the specific symptoms are, will determine whether you're safe to be seen by us. And a nurse practitioner or a physician assistant and a med tech would come out to your home and be able to provide those types of services to keep you safe and keep you from having to have a disruption from going to the hospital or going to the ER. In many cases, some cases, hospital and ER is still the appropriate path. And as a member, when you talk to our teams in the call center, we'll make sure that whether you're safe to be seen by us or not.
It blows me away, Daniel, the with the advent of connectivity, the way it is today. And we talk about virtual solutions. And in our last episode, We had the chief operating officer from Care Talk Health talking about what they're doing virtually, also sort of getting into someone's home, but not literally getting into someone's home. I couldn't believe when I began to learn more about Dispatch Health and what you guys do. You literally send like an emergency room to somebody's house. I would imagine you could do everything probably just short of surgery right then and there. So the evolution, it's a healthcare evolution of healthcare, but it's an evolution of everything. And there are so many commonalities what you do and what you're doing in a healthcare environment to really what so many other industries have to focus on today, because we're in people's homes and people are in our homes and everybody's all together. So um, I would imagine that you're using your years of operational experience to sort of leverage that experience and to make it really work in this environment.
Yeah, absolutely. Let me share a quick story so that way your audience can get a good sense of the service Dispatch Health provides, and then I'll share some about how our dispatchers within our contact center enable a great start to that journey of them being well taken care of in the home. My mother actually used our service some time ago, and what was interesting about her visit was that she needed some care for a particular part of her body. I'm not going to share that part due to medical and HIPAA rules. But when the team came out, they noticed something different when my mom said, "Hey, where do you want to be seen in the house?" So she said, "I want to lay down in my bed and you can see me here." And while in the bed, getting in and then getting out, they noticed that she took a few seconds before she got in, before she got out to get into bed. Definitely a pause. And so the clinician checked in with my mom and said, "Hey, I noticed you paused. Is there anything in particular about that?" She goes, "Yes, actually, every time I get in and out of bed, I get a little bit dizzy, mostly when I'm getting out. Um, and so I always want to just be super careful and make sure I don't fall." And so the clinician looked at the bed and said, "Yeah, the problem is your bed is too high." And so her blood pressure was dropping when she was getting on the bed.
Hmm.
And because of that, they've now removed the frame and put the box spring right on the ground. And now she no longer gets dizzy getting in or out of bed. And that's the breakthrough type of service that can happen. And when the clinician comes to your own environment, which you live in every day. At no time, she said, this has been happening for years, and I would never go to the doctor and talk about this because I had never correlated them. I didn't even know to bring them up. And if the doctor doesn't know how high my bed is, he wouldn't know to say anything anyway. So the care in the home creates a unique experience for breakthroughs in other ways. Um, so now it's come back to the contact center side of the business and making sure that we can onboard this patient efficiently and safely. And so there's been a tremendous amount of work within Dispatch Health and within the call center. We call it the Access Center because it's access to care. And it's all about first and foremost building the right culture. And when you look at culture, everyone has a different definition of it, and most companies have very different ways that they execute culture. And so when I talk about culture, I'm talking about from the moment that someone learns about our brand, whether it's a external patient or provider. I'm going to focus on the employee path, though. I'm going to focus on the agent path here. And so from an agent perspective, is the moment they hear about our brand, and then that they hear and see potentially a job description, or they're talking to a friend who works for Dispatch Health and wants to learn more and potentially be referred to an open position. So how do we frame that? Do we share in our job descriptions specifics, not just about the role itself, but what success looks like in a very meaningful way? Are we specific enough that someone can get a real sense of what the day in the life is and look at that job description and go, yeah, I can see myself doing this every day and being satisfied and being able to make a difference. Most people want to make a difference, whether they know to say that directly or not. And so it immediately engages them. It's about being external focused, not being focused just for the company, but being focused for the individual looking at the organization. So from the very first moment, we want to be about them and about team. There's a great acronym that I use to this day. I learned it many, many years ago, and it's one that many of you've heard of. It's called TEAM, TEAM. Together, everyone achieves more. And I'm a true believer in that. So from the culture, then it's about training and the onboarding. What does that look like? How is that set up? And at our organization and within the training, we break it down into core competencies that are associated with North Star principles that we've built over time through getting to know using processes like interviews to get to know internal and external stakeholders. And when you interview, a lot of folks may not be familiar with what types of questions to ask. I'll give an example. So for an internal stakeholder, whether you're new to the organization or been with the organization for quite some time and there's needing to be some sort of breakthrough or transformation of how the your organization executes within the business, then and is perceived. Sometimes perception, right? Perception is truth for that person.
Right.
And so how do you align someone else's perception with what is actually being executed or will be executed? And the key is asking questions like, what if I was going to head of sales in an organization, marketing, growth, and I want to learn more about how they see the access center. I would ask a question along the lines of, so tell me, what is most important to you that the access center executes when for your team? What is most important to you? And then they'll let me know. And one of the sayings that I heard at one point that will stick with me for the rest of my career, and this was actually from a leader of a sales team, and she said, "What I want my patients to feel is a warm hug over the phone." So, and that just says everything. I don't think you need more words than warm hug. So we set up training and we set up systems and quality and processes to both hire individuals that can serve warmly, but also individuals that will execute that because they've been trained and because the systems and culture is set up to enable and empower a warm experience.
On that point, though, so, because I think that whether it's patients or members or anything in healthcare, it's a theme that comes up a lot, that of just empathy, right?
Yes.
And really, and that's one of those things that is core. So you obviously, hiring the right people, onboarding them, and then training them. Obviously, it helps, right? Like you're saying, if
Yep.
you hire people that have those skills, but how do you train to make sure that they are consistently empathetic? Because as the day goes on, you get a little tired and the person on the phone might be a little older. How do you constantly drive that level of quality that has to be, I mean, that's like a non-starter if somebody's not empathetic with a patient, right?
Absolutely. And I can share some of the strategies I've deployed over the years that I've found success with. And so what happens is that first it's about the training and setting it up. So the more someone has the knowledge and resources to support the tactical part of the job, the navigating of the systems, the knowledge of the scripting and communications that are required, the clarity in their own minds around the compliance components of the work, and the why behind their work and why it's so critical to not only their role, but how they go about doing that is absolutely critical. And so when an individual begins to understand that, that creates buy-in into the role. That also creates an enablement of empathy. So as leaders, I believe that our job is to be able to make sure that the environment is set up to support the agent. So when they're on the phone or whether they're communicating via email or chat, it doesn't matter the channel. They can have the space to be empathic. So part of that also is average handle time, how long they talk on the phone, how long hold is, things like this. Those are absolutely important, but those are financial metrics. Those are not experience metrics. If you really want to look at an experience metric, you have to look at it from the customer perspective. And so I actually did this at Dispatch Health, where we looked at what I call average time to onboard. That includes the moment that the patient or clinician, the individual that calls in, hits the IVR, the interactive voice response, press 1, press 2, and how long that experience takes, how long the speed of answer takes for the next for the dispatcher, hold, so all the components of average handle time, but also if there's a transfer. Like if we need that individual to speak to a clinician, how long that transfer time is and how long that part takes. That is how the consumer looks at average handle time. It's their full experience. They're going to say it took me 30 minutes to complete an onboarding experience, or 10 minutes, or but if we look at AHT alone, it might say it took 7 minutes or 12 minutes and not represent their true experience. So first, I want to focus on, I want my dispatchers, which is what we call our agents, that onboard patients, to be able to focus on the things that matter most, that they truly have control over. And so that is their soft skills, right? So we talk about soft skills in training. We have them demonstrate how to utilize soft skills in training. We also have speech analytics as a platform to be able to analyze up to 80% of our calls depending on the queue. And out of that, we've learned best practices. So what words and what phrases truly create delightful moments, or de-escalate, or create an empathic moment on a call? So it's all about moments, creating moments. And and then we also have examples of words and phrases that do not. While we don't share who said these words and phrases, because that's not helpful in the spirit of team together, what we do is we share the examples. So it's contrast. Build contrast between how a poor experience occurs and then what is a highly empathic experience. And how does that enable both onboarding potentially quicker, but also being able to get a better outcome for this patient where they feel very confident. Uh, so last thought here is that trust. Trust is, in my mind, the most important word that organization, a company, that that a department, such as the call center, that a team within the department, whether that be training, operations, workforce management, and at the dispatcher or agent level, every level needs to have build trust along the way. And if the dispatcher knows their job is to build trust, have the patient or clinician feel trust and create trust over the phone, that drives a need for empathy. So it's all about creating that space and culture, and then a specific word or feeling that we want someone to attach to.
I've always found that personalizing it also drives empathy. Once you get your dispatcher, in this case, to really associate it with something personal, like we've done this in the past, mom and dad, or like Alicia just said with her dad, it really does instill a lot of empathy, and it creates a much warmer, it gives them that a bit more of a warm hug, because you'd want your mom or dad to get a warm
Yeah.
hug. We've been talking a lot about, again, in the evolution of healthcare, who calls you more? Is it medical deserts where there's just no facility and they can't get help? It's not a 911 service, right? Because I'm sure if there's that kind of emergency, you direct it immediately to 911. It's sort of somewhere in between your basic sniffles telehealth, need, and I'm having a heart attack and I need an ambulance to get me right to the emergency room. but who needs you? Who's calling Dispatch Health these days? Who's reaching out? What does your, base of patients look like?
Our base of patients, run from younger than 5 up to a centurion over 100. But the majority are the 65 plus patients that we do experience. Why? Because basically our population is those which get sick. And that is who we focus on. So we are not 100% 911 replacement. However, there are scenarios that someone might call 911 that Dispatch Health can provide a great service for that individual, which many 911 centers plus ambulatory services appreciate, because that frees up their beds, their fleet, to serve those that Dispatch Health can't serve. Those in those high extreme risk acute scenarios where they need immediate care and potentially even some level of surgery or something like that. Something needs a clean room. That's where Dispatch Health ends. If it needs a clean room, meaning a surgery center, something like that, that is not the service Dispatch Health provides.
Geographically, though, do you see that there's, more need in certain parts of the country? In our last conversation that we did with Troy, we did talk about medical deserts and how people have access to healthcare when they need it. Are you finding that you guys are filling that need and additional needs? Where are you getting your patients?
We're currently in 41 markets around the United States, fully focused on the United States as an organization, and those are run anywhere from Denver, where Dispatch Health was founded, to Las Vegas, to Dallas, to Washington D.C., and other markets. But you can hear these are typically more dense populations. Um, and so we find high success in those areas. Can this work in a rural? Yes. The challenge is time to get to that patient could be a challenge because they're much more spread out. So the number of patients that a provider can see in a given day is fewer. Um, so in a lot of ways, we focus more on more dense population areas, but that is not the only area.
How quickly can you get to somebody? And where do you
Yeah.
guys draw the line? It's like, we'd love to help you, but we can't help you because of timing.
Dispatch Health has a 48-hour cutoff, or one business day forward cutoff. I'm sorry, not business day, one day forward. We're 7 days a week, 365 a year service, and so typically we want to see that individual same day. And we book using 4-hour windows. And you talk about service. Let's back up to that for a minute. At Dispatch Health, we actually tested some different scenarios. We had 4-hour windows. We trialed a 2-hour window. We trialed no window, and the patient just chose the time, and we were able to say yes, we can do that, or no, we can't. What's actually worked best for our population is 4-hour windows. Interesting enough. That is a window that someone says yes to, and has the highest success rate of the patient being available when the provider arrives at their home. So one of the things I share there is that it's important to pilot and test different processes, different methodologies, different scripting, uh, and continually to refine the tools. So the CRM solution or the telephony solution or any other tools, the self-service training solution and things like that, those must be able to be flexible and agile to keep up with the pace of change in a business. Dispatch Health is an entrepreneurial company, very much continuing to evolve very quickly in the services we provide and how we provide service. We're a fail fast, learn, and action quick organization. And so in that, that requires being agile. And many of you that are listening may think, well, at my company, we can't be agile with the system. Like there's too many, there's other priorities, everything else. There's, getting something prioritized, getting things like this is very, very difficult. And that's true where I'm at too. So I think that's true for any organization that does not have unlimited resources, which is pretty much all. Um, and so with that, what it becomes about is getting crystal clear on your vision, being able to articulate the vision in as few words as possible, sound bites, and to be able to document use cases. I believe that every leader in a business should be highly skilled at either at an advanced or expert level of writing use cases. Use cases is how businesses make decisions. Whether it's the product team and you want them to make an adjustment to the tools in which your team uses, or whether it's going to finance and asking for additional dollars. Use cases that are defined both with volume and also whether it be revenue or cost efficiencies is what will move the needle, is what I've found and learned in organizations. So if there's one takeaway from this entire uh, uh, podcast today, I would say use cases is how you move the needle for where you want to take your vision with your team.
And I think, as you use cases to make decisions, one decision I was thinking about, we talked about service level. You talk about 4-hour window versus a 911 call. Use case, where do you draw the line? Where is this patient needs me right
Sure.
away, or better stated, doesn't need me. I need to get them a 911 because I can't get to them quickly enough, as opposed to, this patient, could just go to their doctor. They're looking for their annual wellness visit. We don't want to do that. So kind of, where do you draw the lines?
That is taking a very scientific approach. So some organizations have some sort of data analytics group, and Dispatch Health has that as well. And then I talked about speech analytics earlier. So what you'll find if you start listening or hearing a lot of calls around symptoms as patients describe them, they use a lot of words for the same symptom. And so we have a process that is proprietary to Dispatch Health. We call it risk stratification. And we have green, yellow, red for patients. Green means they're safe to be scheduled, seen. We're actually working on how to automate that process to simplify it for our patients. And I'm leading an effort around self-service for our patients. But there's also yellow and red scenarios. In those cases, that patient or a provider who's onboarding a patient will speak with a clinician at Dispatch Health, and the clinician will assess whether they're safe for us to see them or advise that patient to hang up with us, call 911, or go directly to an emergency department or urgent care center. That is how we make those decisions here at Dispatch Health, but very data intensive. So that way, we continue to refine that model as more and more data rolls in.
That sort of follows suit with a lot of businesses, really, and just how you define what we're going to do, what the rules of engagement are. Before we wrap,
Yeah,
we cannot leave a conversation about healthcare without talking about the potential role of AI in your contact. And where is it today? Where do you see it headed?
it's a board level initiative to drive AI into our business in an appropriate way to be able to generate a better health outcomes for our patients, while also being as cost efficient and as possible to do that, right? If we're cost efficient and we drive better health outcomes, that means we'll be able to serve more patients. And that's really the mission of the organization. So now let's back up to the call center and how AI can be applied and is being applied. Speech analytics, I've talked about that a couple times. It's a great place to start. It has a huge return on investment. One, from a quality perspective, if you have a quality team today, they're analyzing most likely, unless it's a very small queue, they're analyzing anywhere from 3% down to 0.3% of calls. That is not reflective of the overall work that an individual does particularly, but also a team. It's too small a sample set. So speech analytics allows you to open that up to anywhere from 50% plus, depending on your budget, depending on the variations within the calls that you want to analyze. And what happens is you still have a QA function that will both identify new and novel uh, uh, items that need to be QA'd, quality checked, as well as calibration with the AI. So one of the big takeaways that we've had as an organization, and that I've been advocating for, is how do we solve for a center of excellence when it comes to bringing artificial intelligence into an organization? Artificial intelligence is both on the data analytics side, but it's also on the experience side for the internal employee and for the patient. So there's all different branches here, but let's stay external focus for a moment. The individual calling in, or the individual chat, or however whatever other channels an organization provides. If that individual is being quality checked in one system, the way that we've done forever, which is, basically the phone-based standard quality process, and then another day reaches out and uses the self-serve option. Maybe they stay in the self-serve world, maybe it's a partial experience, AI-led self-serve, and then it transitions over to an agent to complete the call. That's called hybrid. And what if you have two different systems measuring quality, then you're not looking at a holistic experience for the caller or that patient. So I'll go back to trust, what I talked about earlier. How do you build trust? One key word is consistency. And so from a quality perspective, having a holistic, cross-functional, seamless way to measure and address different quality issues, no matter whether it's through AI powered solutions or our traditional paths, is going to be absolutely critical. So let me start with that. And what I'm finding when I'm not just talk within our own organization, but I've spoken with over 40 different organizations that focus on AI delivered services. So these are the vendors out there that provide the service, everything from telephony to workforce management, AI being AI powered, to training, to and then to agent assist and interactive voice agent. There's many more phrases I can throw out there, but at the end of the day, use cases, I'm going to go back to that, are absolutely critical. Otherwise you're going to spend a lot of time, a lot of resources to solve uh, and being able to determine whether AI is right for your organization, but you're not going to get as far as you need to or want to. There'll be a lot of frustration. So how do you solve that frustration? Is first you look internal. And at Dispatch Health, and I'm Black Belt Six Sigma certified, so we use Six Sigma methodologies, Lean Six Sigma specifically, to be able to identify uh, root cause analysis on why calls take so long, why are we getting duplicate callers, and other issues that are being identified. So define, measure, analyze, and improve, and then control. That's how I've found to be most successful with identifying these use cases. From there, the way Dispatch Health is looking at using self-serve is on the IVR front. No, there's only a couple companies I've called into, and I won't name them here, even though it's a positive story, that have had exceptional IVR experiences. Most organization, it's a headache. It's hard to get through, and you can't even get to a person when you want to. Well, that might be by design, but many companies, I believe it's not by design. And so revisiting the front end of the contact. So that can be the call in through an IVR or interactive voice agent, or it can be on a chat session, how that chat is opened, and how easy it is to navigate through a chatbot that's AI powered before you identify whether a human will engage or not is absolutely critical. The last thing I'll say is it's okay to start really small. In fact, I'd recommend that. If you tackle the most complex problem, it's going to take the longest to get out there, and you won't be gaining experience on how your consumers or business partners engage with the tool. And it's very important to get those beginning learnings. So starting small, even starting internal with the tools, and once it's really refined, it's tested, everyone's comfortable, it works 100% of the time, then bring it out to the consumer.
I couldn't agree more. And I think particularly in healthcare, it's really important to keep a human in the loop at all times, because AI is amazing, but AI is not empathetic. AI is not going to give a warm hug. And so you need that human in the loop. So,
It's interesting you bring that up. I was doing a study recently on the contact center of the future, and
mhm.
we're looking at another 5 years plus before we really truly have empathetic AI. um, you'll see some beginnings of that in the next few years, but it'll be about 5 to 10 years out before we have truly empathetic AI. And so, absolutely right. What can be very straightforward, what can be direct kind of communication, that's a good place for using AI powered solutions today. High empathy, you'll want to tie in some sort of process that engages humans. Now, it can be behind the scenes, chat with a human behind the scenes, monitoring, and then putting in a phrase here or there, or engaging in a certain way for a limited time could be sufficient. Depends on your business need.
That's really well said. And wow, that's I think this was an incredibly insightful podcast that we've recorded today, Daniel. So thank you for, as always, for sharing your wisdom so articulately and eloquently, and really just easy for really anybody to follow some of these tips for success. So we appreciate having you here today.
Always great spending time with you, Daniel. It's thought-provoking, at least. I am anxious to follow up and do another one with you in several months and kind of see how things continue to unfold. So thanks so much for spending time with us.
Absolutely, and thank you for having me. And look forward to continuing the conversation.
All
For
right, so
sure.
that wraps up another episode of CX on Point, and we thank you for joining us. Make it a great day.